dogs, cats, and rabbits account for 20% of problem visits at small animal veterinary practices. The deep external ear canal of pets is a dark, warm, slightly moist environment that makes it a real target for a multitude of infectious, parasitic, and allergic problems. Each pet species has different problems, so I'll cover all the most common ear diseases today. Also, I do want to point out that our pets can and do occasionally get middle and inner ear infections like children are famous for. But the majority of our pets' problems are centered in the external ear canal, so that'll be my focus. Let's talk about cats and rabbits first, as they have a more limited range of common ear diseases. In young kittens and bunnies, I most frequently diagnose ear mite infestations. Ear mites are microscopic insects that are transferred from adults, usually the mother, and the symptoms are head shaking, scratching at the ear flap causing hair loss, and seeing dry black coffee ground type debris in the canal. Killing all the mites can be achieved in many ways. There are daily ear canal treatments that must last 3 full weeks, a one-time topical ear canal treatment, and then there are combination products that are applied to the skin over the shoulders, such as Advantage Multi or Revolution, that eradicate ear mites, skin mites, fleas, and intestinal worms all at once. Cats can get yeast infections in the ear canal, which produces moist, pasty, foul-smelling debris, causing shaking of the head and scratching. Deep ear canal examination allows us to collect a sample for microscopic identification of the yeast. Yeast can be treated successfully with topical medications in the ear canal for about 2 weeks. If the cat owner observes pus in the ear canal caused by a bacterial infection, this most often indicates an underlying tumor is present somewhere in the ear canal, as feline primary bacterial ear infections are rare. In young cats, benign ear canal polyps are common, and in senior cats, benign or malignant wax gland tumors predominate. With all types of cat and rabbit ear infections, some cleaning of the ear canal to remove heavy debris is beneficial. Usually we start with a professional cleaning and flushing in the office. Then as the pet is being medicated at home, we teach clients how to safely remove the debris that works its way to the outer part of the ear canal using a twist of loose cotton and screwing it down into the ear canal to thoroughly clean out the debris that makes its way to the surface. A good ear cleaning solution like the Epiotic brand will dissolve wax, break up debris, and help to dry the canal. Allergies in cats can make the ear flap, called the pinna, very itchy, often with hair loss, much head shaking, and scratching. Through examination of the canal and taking a careful history from the owner, your veterinarian can usually differentiate allergies from infections and then treat appropriately. Dogs and cats have the widest variety of ear problems and by far account for most of those office visits. Some puppies and kittens do get ear mites, just as I described in kittens and bunnies, and the treatment is the same. There are well-known breed predispositions for ear diseases, so there must be a genetic and probably a floppy ear conformation predilection to ear problems. Think spaniels, retrievers, and all the floppy-eared sporting breeds, which are definitely overrepresented with ear infections. In contrast, when it comes to infectious ear diseases, breeds with upright ear flaps that allow for good air circulation like German Shepherds, Huskies, Shelties, Min Pins, and many terriers are rarely seen with ear infections. Dogs with deep L-shaped external ear canals, which are covered over by floppy ear pinnas, are likely to have the perfect storm of moisture, poor air ventilation, and warmth necessary to incubate infectious diseases in the ear canal. There are resident yeast in most dogs' ear canals in small numbers that are the normal skin microbes in this location. When these yeast find the environment I described above, they will start dividing rapidly in some dogs. This growth and resulting irritation leads to more moisture being produced at the skin level, which in turn promotes more yeast growth. Pretty soon, the dog's scratching his ears, shaking his head, and the owner is smelling a characteristic fungal odor. So most dog ear infections start with a yeast infection that, if it were treated early and aggressively, would respond rapidly to anti-yeast medications within 10 to 14 days. However, there are some genetically susceptible breeds that seem to be more difficult to completely clear, and it can lead to a smoldering ear problem. Generally, a professional cleaning in the office is the best start for many dog ear infections. If the ears have progressed to a very painful state, some dogs even must be sedated to accomplish a thorough cleaning and gentle flushing. Equipment like a video otoscope can assist the veterinary staff to see deep into the ear canal to carefully remove stubborn debris that can't simply be flushed out. Then, ear cleanings while medicating at home using cleaners like Epiotic brand applied to twists of soft loose cotton like I described before and then screwed down into the ear canal can be very effective. Using cotton swabs carefully at or near the ear canal opening to pull out loose debris helps as well. Now, if left untreated or not completely resolved, many dogs will maintain a moist, yeasty ear long term, which can then lead to a secondary bacterial infection. It's easy to imagine how this happens when the dog scratches at his ears with his rear paw that might have just been running through the park where feces could be in the grass. Fecal bacteria like E. coli and Proteus can cause some of the most painful and foul-smelling ears imaginable. Another nasty bacterium always on the lookout for a moist and warm place to set up is Pseudomonas, which can be resistant to multiple antibiotics and is a real challenge to eradicate. Veterinarians will often prepare microscope slides to examine for the bacteria and take cultures to send into the lab for identification and testing of the bacteria for susceptibility to dozens of antibiotics to find the right one that will work best. With this knowledge, your veterinarian can suggest topical ear canal treatments, special cleaning solutions to make the bacteria more susceptible to antibiotics, and sometimes prescribe oral antibiotics to assist in effecting a knockout of the bacterial invaders. In dogs with very painful ear canals or who are totally impossible for the owner to treat at home, we can completely pack the ear canal full with a thick, viscous antibiotic anti-yeast ointment that clings to the ear canal for 2 weeks, continuously treating the surface skin. When good control of an ear infection is documented by your veterinarian, but it recurs repeatedly soon after stopping the medication each time, we have to consider other predisposing underlying causes, like immune system deficiencies or allergies in your pets. Both inhaled seasonal allergies, like those due to plant pollens, as well as non-seasonal allergies like environmental house dust mites or even food hypersensitivities can all lead to very itchy ear flaps and secondary ear infections. With a careful history from the owner and a deep ear canal examination that early on is often normal, your veterinarian can usually sort out the true underlying cause of recurring ear canal infections and begin allergy treatments to give your pet relief. Dogs also get ear canal tumors that are benign or malignant, but less commonly than are discovered in cats. A much more common problem of dogs and occasionally in cats is the ear flap hematoma, which is a collection of blood and blood serum under the skin of the ear flap, usually caused by vigorous, frequent shaking of the head secondary to an underlying ear infection. If the ear flap strikes an object, like the rung of a chair when it is being shaken by the dog, then a vessel can break, filling the ear flap with blood. Over the years, there have been many surgical and non-surgical treatments for this condition that drain out the liquid while attempting to prevent the flap from refilling. Obviously, the underlying cause must be identified and treated too. So, how can you, the pet owner, prevent most of these problems that are annoying for both you and your pet? The best advice I give to all new puppy and kitten owners in our practice is to start acclimating pets at an early age to handling the ears and performing regular, gentle, low-impact cleaning of the external ear canal and flap so you can identify any future ear problems very early when they are most treatable. Then continue routine ear cleaning every 7 to 14 days for surveillance throughout your pet's life. Any excessive debris or especially unusual odor should be brought to your veterinarian's attention as soon as possible. And this has been another pet health tip from the staff of the Pittsburgh Spay Vaccination Clinic, a full-service veterinary facility.